I think since we first did this in Leeds, however many months ago, a lot of the conversation has changed and moved on, which is brilliant. And we really are starting to hear a lot more about the people who are involved. For those people who don't know me, I can see a couple of faces in the audience that I haven't seen for a long time, so that's very nice to see. I used to work for Cornwall Council, did 10 years in local government, and in the last 5 years was in a role around performance and information governance. So I understand the information, IT security, information sharing issues that a lot of us face on a daily basis. I was part of the bid development for Cornwall's Pioneer submission, and I'm now part of the core Pioneer team in Cornwall, which is actually made up of a whole range of different people from health, from the local authority, independents like myself, and people from the voluntary sector, which brings a really interesting dynamic actually and dimension, which is very relevant to the kind of integrated intervention that we're looking to develop. And a lot of the information sharing challenges and solutions are not technical ones. So when Martin contacted me all those months ago, I said, well, you know, we've done these things. They're not really about technology. They're not about joining systems up. Are you sure that I'm the right person to come and talk to a group of IT professionals about how you get over some of the information sharing stuff? So what I want to talk to you today is about how you navigate, or how we've navigated in Cornwall, some of the challenges and barriers and how we've overcome some of them. And again, it's an ongoing dialogue for us. We learn every time we come and listen to conversations like we've had today about what we could do differently and what we could do better. So this is our story. Just very briefly, which sort of came across in the DVD that you saw, but wanted to just say, what is this thing that we're doing in Cornwall? And it's very, very similar to the Pioneer approach in Leeds. So this is about supporting people to live the life that they want to the best of their ability. Now that is about individuals making decisions and choices about their own lives, and crucially, what it is that they want to achieve from their lives. So traditionally, for a lot of us working in local government, we have social workers who go out and do an assessment. They have a list of questions that they want to ask and some boxes that they need to tick. Very rarely do health and social care practitioners actually have the time to stop and listen to people's life stories, to find out who they are, what's important to them, and what their goals and aspirations for the future are. And that's what this model of delivery is about. And that conversation, what we call a guided conversation, happens with somebody from the voluntary sector. So they go into somebody's home, they have a conversation that's guided by the person themselves. There is no form, there are no set questions, it's not an assessment. It is simply about understanding the person, what journey has led them to the point that they're at, and what they want to achieve from their lives. And then building a plan, if we go back to the King's Fund DVD right at the beginning, building a plan, a shared plan for that person that helps them to achieve those goals and aspirations. And they can be very small things, or what seem to be very small things to some of us. It can be simply being able to get out and walk their dog on the beach. It can be somebody who has spent the last 5 years having somebody else buy his wife's anniversary card because he can't get out of the house. And what he wants to do and what's important to him is that he's able to go out and choose that. And they're not huge things, but when we come from the perspective of a health or a social care practitioner, what we tend to do, because of the organisations that and the structures that we work within, is to layer in lots of other stuff. So we come in and say, well, maybe you need this bit of equipment, and maybe you need help with managing this condition and this prescription. And actually, we don't necessarily take the time to listen to the person. And what we found is that actually, a lot of the time, what makes people healthy and happy is when they feel valued, when they feel part of a community, whatever that community is, whether it's your geographical location, whether it's something that you're interested in, and when they're supported by a network of friends and family, not health professionals. Because I don't know about you, but when I get through my life journey, or if I come across a situation that I find challenging, the people I want around me to support me are my friends, my family, and my community. They aren't really professionals, and I think sometimes we get a little bit removed from that. We have our challenges, which I am sure are in no way different to everybody else across the region. Because our delivery model is very much based around the voluntary sector, who are the core part of that guided conversation with individuals, and then coordinating care around that, which might come from the community health services, it might come from social care, might come from occupational therapy, a whole range of different things. How do we get the voluntary sector having appropriate access to health and social care data so that they can be part of a multidisciplinary team and they can share information with other practitioners? We have a huge geography in Cornwall, and even in the area that we're working in, which is the very, very west of the county, it's a very large area, working probably across 10 to 15 different office bases across a whole range of different disciplines. So how do you share information across a geography and across multiple team members? We were talking on our table about doing a mapping exercise with a multidisciplinary team about the bit of the process when somebody phones up saying, I'm a bit worried about mum, what can you do to help, to the point that somebody decides they're going to go out. And we mapped 42 different information systems. And that's a relatively, in Cornwall, we have, relatively few health organisations there. 42 different systems that people were just checking and then maybe double checking to make sure they had enough information before they made that decision. None of them are linked. We have no web portals, no fancy technology that links everything together at the moment. Thirdly, we had a real need, and I think it's been talked about already. I think Julie mentioned it in her presentation, and it's certainly one of the questions in the session we've just had about how do you evidence that you're actually making a difference, and not just evidence with nice stories of people, but actually nail it down to are you doing this at a reduced cost, which is one of our outcomes. So we have a huge need to bring cost and activity data from across every organisation in our health and social care economy to try and demonstrate the impact, and the huge information governance issues around sharing that kind of data at a person level. And then the thing that we're all struggling with, which is how do we do this yesterday and preferably last week and on about half the money that you've currently got, because time is running out for all of us and we need to demonstrate impact quite quickly. I'm sure those are resonating with colleagues in the room. So, what have we come up with then? And a lot of the things that we have done have been a way of navigating around some of the information sharing challenges that are presented by working in a more integrated way. And I think perhaps one of the things that I would say is our overarching lesson is actually the one at the bottom, is we can't sit around waiting for national government to amend legislation, to change section 251, to create shared protocols and standards, because if we do, then we'll still be here in probably 24 months' time having the same conversation. So there is an element of that stuff that goes on up there that necessarily will have to go on, but I would really encourage people to try and find local solutions to the local issues that you face. Found is that having a conversation about consent is quite easy actually when you're sitting in front of a person and you're talking to them about their life and the reasons why you want to share their information. It's not so easy when you do care.data type leaflets through people's door. So even though we had that debacle, we've actually managed to get around that by having individual informed consent for everybody. And that's both for the direct care, so the sharing of information to help support their actual care, and for the sharing of information in order to research and evaluate the impact of the programme. We have a whole range of honorary contracts for our voluntary sector staff. So we have honorary contracts with the GP practices, which enables teams to sit in the practices to have access to the practice data. We have honorary contracts actually in the last 4 weeks with the local acute trust. We now have Age UK practitioners going on daily board rounds with the discharge team in our acute trust, actually actively taking referrals and facilitating hospital discharge. And there are amazing stories about saving weeks literally of people sitting in hospital beds by virtue of the fact that Age UK in this instance are able to actually pick up discharges and get people out of hospital. We have honorary contracts as well with the Community Health Organisation, and that's something that we've had in place for about 3 years now. It's a little bit labour intensive, but it does help to give confidence and trust, I think, for particularly health organisations around having the voluntary sector there. We had in Cornwall a Cornwall-wide information sharing protocol, but again, at very high level. And what we do is where we start working in our pilot sites, we then create an information sharing agreement that's specific to that particular locality and that's signed up to by everybody from the GP practices through to the voluntary sector, through to some of our technology partners. So in Cornwall, we have BT Cornwall as a strategic partner, so that we're just really robust and watertight about how we're sharing information. And again, going back to that bottom issue, not waiting around for some of the strategic issues to be sorted, getting on with things and building trust and relationships, I think, wherever you're working has been the most important thing for us. One of the other things which actually isn't on that slide is how we've managed to have Age UK accessing a healthcare system. So our mental health trust came forward in the early days and said, well, you know, we can give you access to our Rowse system if you'd like to use it as part of your case management system. So that has been a huge leap forward for us, because it means that Age UK are actually using a recognised health system. You have to comply with the IG toolkit, which is absolutely fine, but it sits within a trusted NHS system, has access to National Spine. And that's just by virtue of having a good dialogue and a good relationship with the Mental Health Trust, and then wanting to facilitate doing that with us. I think going back to what Julie was talking about, and also what was on the film, at the end of the day, one of the things that we tend to focus a lot of time and effort on is what difference, you know, this is all lovely, all this information sharing stuff, and that's great, but actually what difference has it made to real people on the ground? And if you do get a couple of minutes, I would encourage you to just have another look at YouTube, because there are other videos on there that talk a lot more about real people and what the impact of being part of the programme has been for them. And this is one of our real people from Newquay, and a whole range of, we work with people who are very, very unwell when we first start to see them. So Beatrice has diabetes, stroke, partially sighted, very anxious, understandably, formal carers 4 times a day, fortnightly GP visits if the GP was lucky, otherwise she was in there every week, and seeing a whole range of what we would consider to be professionals. And nowhere on that left-hand side of the screen can you see anything about friends, family, and neighbourhoods and networks. So all the people that were in Beatrice's circle of care were professionals. What we did with Beatrice was we went in, had a guided conversation with her, wanted to understand what was important to her, and the thing that was important to her was actually being able to get out. She used to be a very sociable person. She had run a B&B and had gradually shrunk her world from being out there talking to people a lot of the time to being stuck by herself in one room. So we supported her to go and attend a counselling course, balance and stability courses to get out, walking her dog. She now hosts her own coffee morning. She's one of our 10% who's actually now giving back to other people in her community. So rather than going out to coffee morning, she actually has people round to her house every week. We use a wellbeing score that we measure, and you can see that her scores have increased dramatically. She actively got in touch with social care and said, you know what, I don't really want carers coming around 4 times a day because I'm busy doing other stuff now. So we've actually seen a reduction in her social care package, and her contact with her community mental health nurse has gone down. And critically, and I think this is really important, because otherwise what you end up doing is getting the voluntary sector coming in and just creating dependency on the voluntary sector, which is cheaper than social care, but it's still a dependency, is actually she doesn't have any support from the voluntary sector now. She's got her own networks of support that she's created for herself. And all we need to do is just see whether or not she wants anyone to come around and make a cup of tea and while she hosts her own coffee morning. Critically, I think you wouldn't be able to do, or you wouldn't be able to see that change for Beatrice if you hadn't had practitioners sharing information about her, about what her goals and aspirations were, about what was important to her, about what we needed to do in order to get her to where she wanted to be. And I think more critically, going back to the King's Fund video, actually, it's about all of those people who were in Beatrice's life were only coming in to talk about their bit of her life, and actually not talking about who she was as a whole person. And that's what's made a difference, I think. It's about understanding Beatrice as a whole person and helping her to achieve what she wants. A few lessons that are worth sharing, and as I said, we learn all of the time, new lessons, I think. There's a real sense, having worked in information governance, that it's a barrier and a blocker, and actually that isn't the case. The number of times I've heard people say Data Protection Act should be used to do things, not to say no. So I think there's something about us as information governance and technology practitioners actually to try and challenge that culture or that perception that we're here to just say no to stuff. But organisational culture is very powerful. So, you know, you do get people at the front line saying, oh yeah, I've got that information sharing agreement. I'm still not going to share that information with you. So you have to constantly reinforce why we're here, why we're trying to do it, and challenging people's behaviour at the front line. And critically, I think that's why I said to Andy and colleagues from Somerset, you know, you've been doing some really good stuff. Celebrate that success, even though they seem like small things. Where you get information sharing or information governance successes, talk about them, and reinforce that doing the right thing is actually the best thing for people. We have to challenge our own attitude to risk, and it goes back to the final question, you know, how do you, what it was now, but something about how do you help people to make decisions about their life? You know, most of us go through our lives, we're happy, healthy, and able to make our own decisions, and then somehow we either get old or something happens that means suddenly overnight we're not able to make those decisions for ourselves. Well, actually, people were making decisions about their lives yesterday, they should be able to make the same decisions about their lives tomorrow. It's not about us as organisations or as practitioners to suddenly say, well, actually we need to manage your risk. People need to be enabled to take the risk themselves. I think building relationships and maintaining trust is probably our biggest learning area. And that doesn't really matter whether it's strategic leaders, chief executives getting together to talk, or if it's about practitioners on the front line, or in some of the work that we've been doing around having information governance leads together regularly, just so that you can build up that trust and relationships, is really, really critical. And sharing concerns, debating things, you know, my interpretation of something will be different to yours, but the way we operate in Cornwall is very much to say, look, this is the point we're trying to get to. There has to be a solution. Let's debate it and we'll agree it together. And it's about taking people on a journey and not getting frustrated when information governance people occasionally revert to type, which we all do. I think there are information sharing mavericks out there. There are people out there who really get it, and as we were saying on our table, will do things in spite of their organisation. I'm not talking about breaking the law. I'm just saying they will be solutions-focused people who are really up for trying to find a way through things. Find out who they are and talk to them and get them working with you, because they are out there. And I'm sure, you know, we don't just have a whole load of them in Cornwall. I'm sure they're out there in your own systems as well. And that example I talked about where we've got Age UK on the Rowse system, that would never have happened if we'd just gone to the information governance and security person and said, what do you think about that? Absolutely wouldn't have got anywhere. But because we had someone there who was passionate about making this happen, we managed to navigate all of the information governance issues that got thrown up. And actually the Mental Health Trust have said they've now changed and adapted their processes internally. It's been hugely challenging for them, but they've actually changed and improved the way they do things within the trust, which is great. The pace of change, you know, again, it can be really difficult to try and recognise successes as you go along, and it's very, very difficult sometimes to try and balance the need for strategic people who've got to save, in some cases in local authorities, and certainly in Cornwall, hundreds of millions of pounds, and in the health service similarly, with actually putting in place things on the ground that are sustainable. You know, you can't do projects that last for 5 minutes and then suddenly aren't there again. And that is a really difficult tension for us, which we're balancing all the time, constantly thinking about what information can we give strategic leaders that keeps them comfortable and on the journey still, and keeps the momentum going. And I think just before I finish that last one, don't try and bite the whole elephant off in one big chunk. You know, start in a manageable way, work with people who are interested and passionate about what you're doing. Don't try and conquer all of the strategic issues up front, because momentum will build and you'll get people who are interested and become your champions, who will do a lot of that work for you. And finally, I think for us, it's been really important to use real people's stories, because it seems really obvious when we work in a health and social care environment, which is absolutely about people, that sharing real people's stories would be an obvious thing to do. But I think sometimes in the statutory sector, we take off our human hats when we come to work sometimes, I think. You know, at home, we're parents, mothers, daughters, we look after people, we keep an eye on our neighbours, and then we come to work and we're IT professionals, or we're a social worker, or we're a GP, and somehow we don't allow the two things to mesh together. But really connecting with people on an emotional level to understand what's happened for that real person actually is very, very difficult to argue with. And it also keeps the momentum going when things get really, really tough. I think for those of us, and I would count myself in this, who can be quite far removed from the front line, actually, we certainly in performance and information governance roles, I don't see real people from one day to the next. It can be quite difficult to understand the impact of what we do on real people's lives. So it's really important on a personal and I think on a professional level to just keep re-engaging with real people's stories. And use those stories to celebrate the things that are really working in your area. You know, what seem like small successes actually probably quite groundbreaking. And the power of language is the other thing, although as you can see from the DVD, we haven't quite cracked the word patient being used repeatedly by Dr. Anderson, but I'm working on it still. So we talk about people, we don't talk about service users or patients, and we talk about practitioners. We don't talk about professionals because we have volunteers as part of our team and they're just as professional as a trained GP or a hospital consultant. And finally, I guess just really taking it back to Annie is our best lesson. And this is Annie from Newquay. And I think I'll just leave you with this, because you guys in the work that you do are critical enablers to delivering integrated care. You know, all of the things that we've talked about today about making life easier for practitioners at the front line, about giving people access to their own information. I think one of the things I talked to Martin about, you know, we have to expand our thinking beyond health and social care, which seems like a big nut to crack anyway, but a lot of us are out there working in the voluntary community sector. And I think some of what we do know, if you take Julie's 2070 scenario, is a lot of the services that we're currently delivering within the statutory sector probably will be delivered out in our community. So we need to just broaden our horizons a little bit about where we're focusing our time and effort. I think we need all of us to be listening to real people's stories and understanding what it is that they want to achieve, and building the systems and the technology support to support that, not to support our own organisations. And I think just going back to that point earlier about remembering why we're here, you know, we are IT and information governance practitioners, but we're also members of our own communities. And I think that is what Annie's talking about when she says, actually, all she really wants at the end of the day is to be treated like a human being, not a poor, worn-out thing in a chair. And I guess the thought I would leave you is I think that's probably what we would all want at the end of the day.